I became unemployed and of course uninsured thereafter, and after a while I kept going into hospitals, and due to that I found myself with bills.
There are 50 million Americans like Maite, unemployed, uninsured, and believing their only health care option is a county emergency room. But there are other options.
We can take care of your basic primary care needs. We can do preventive work with you. We can do basic labs with you. We can ensure that if you have high blood pressure, that's controlled before you end up in an emergency room. And we can do that in a subsidized way for you.
That's the CEO of CareSource, one of hundreds of federally qualified health centers nationwide that price their services based on your ability to pay. If you have no money or insurance, you still have a doctor.
Now that's one option if you don't have insurance or you can't afford the insurance being offered by your employer. But there are other options.
Check Medicaid. If you make too much money, your kids may still qualify for your state's Children's Health Insurance Program. You can find out in less than a minute at this government-run state-by-state directory.
Now, if you need medication, there are lots of places that can help with that too. Some programs even offer free prescription service for those in need. And let's not forget, some of the large chain grocery stores and drugstores are now offering really low-cost prescriptions on some medications, as low as $4 a month.
And if all this seems confusing, there's also plenty of free help out there to help you find free help. Try Healthcare Advocacy, the Patient Advocate Foundation, and Patient Services. Bottom line, if you're out of insurance, you're not out of luck.
I want to change jobs inherently, right? So comparing people in jobs that offer health insurance to people in jobs who don't offer health insurance is making a comparison across people who differ in more ways than just the fact that they have health insurance through their jobs, right? It's the problem with all cross-sectional regression. Also, there's also this sort of general fact that jobs that offer health insurance tend to be sort of better jobs, right? They tend to be at more stable firms. They tend to have firms that are sort of doing better in the market and have more job security. You're much likely to have to change jobs for job-based reasons, right? Because your company is deteriorating. There tend to be better jobs. And so there's sort of a selection in sort of what the job type that comes with health insurance is as well. There are some quasi